Hello, everyone. You are welcome to the Discovery Show, TDS TV, here on Facebook and on YouTube. Good evening, good morning, good afternoon, wherever you are watching us from. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, and the likes. And so we seek to discover their successes, their challenges, so that together we can rise. We want to leverage on their experiences so that we can fly with them. And so this morning, this afternoon, this evening, wherever you are watching us from, please share this live stream. Please comment, send your comment, and we will read them. Where our guest needs to actually respond to them, he will do so accordingly where necessary. And we also encourage you to like our page on Facebook and on YouTube. Once again, this is the Discovery Show TDS TV here on Facebook and on YouTube. My name is Precious Adadidiodu, ably supported by Mr. James Kobina Opong. This evening, I'm privileged to be interviewing one person I've known for some years, a very studious person, someone who has been doing so well, so far. And I'm privileged to be interviewing Jerry John Nutor, an assistant professor at the University of California in the United States of America. JJ, you are welcome to the Discovery Show.
Thank you, Precious, and thank you.
Thanks very much for honoring our invitation. And can you just tell us a bit about yourself, JJ?
Yes, thank you, Precious, actually, for inviting me. I thank you and the team for this wonderful initiative, and I must commend you for that. So a little bit about myself. I am, as you said, Jerry, and I am a nurse by training. I started my nursing education at Whole Nurses Training College in Ghana. And then I ended my training at Princeton University as a postdoc. And I'm currently at University of California, San Francisco, where I'm assistant professor. My research actually focuses on HIV medication among pregnant and breastfeeding on new mothers in sub-Saharan Africa, where I look at factors influencing treatment among this special group, and also look at how to prevent mother-to-child transmission of HIV. And I must say that I'm also the Secretary General of African Interdisciplinary Health Conference, which is an annual event focusing on disseminating of research finding across Africa and beyond. And that is me. And as we go on, I'm sure I'll say more about myself for the listeners and or the viewers to know more about me. So thank you.
Great. Thank you very much, JJ, for sharing so far with us. As you said, as we go on, I'm sure we learn quite a lot from you. The first time I met you was a little over 10 years ago, and that was through students' leadership platforms. That was University Nursing Student Association of Ghana. You became the second vice president for the second executive board. Did you hold any other positions apart from what I've just mentioned?
Yes, thank you, Precious, and also I thank you earlier on. I didn't thank the listener and viewers, so thank you, listener and viewers, for watching. And yes, I remember we met. That was very long ago, and it looks like yesterday, but actually, yes, I held several leadership positions. I think leadership or taking initiative and leading is something that I enjoy doing. So I have done that at every level of my education. I think back to primary school, as you will call it in Ghana, to my PhD level, I've held several leadership positions. Like you said, I was the second vice president for the Investing Association then, and in my master's program at University of California, Davis, I was a member of the Graduate and Professional Student Chancellor's Graduate and Professional Student Advisory Council, where I was in a group of, I think, 6 or 8 that we met with the Chancellor regularly to provide provide her with information and how to improve students' experience and life at University of California, Davis. Then moving to where I did my PhD at Drexel University, I was the Graduate Student Association President for 2 terms. and I enjoyed that a lot, and I like doing that, just kind of helping people better people's experience and life in wherever they find themselves. And I think we can do that through leadership, and that is what I enjoy doing. Yeah.
Fantastic. I mean, you are not only academic, but you engage in quite a whole lot of things. That's so
Yeah.
great. I mean, I also know that, I mean, for your masters, as part of that, you have what you call, I mean, Master of Science in Nursing and Healthcare Leadership. So it just ties with all these leadership positions you've held. I just want us to highlight that a bit more. I think whilst we're in school, a lot of people place premium only on academia, and we do not talk about extracurricular activities, and in this case, leadership. What would you say are the benefits of engaging in these extracurricular activities, especially leadership positions, as you just mentioned?
Thank you, Precious. I think that is interesting. I always tell people and my mentees that leadership starts from home when you are a sibling, right? And you have younger siblings, or you have you serving as a leader, and you are trying to, you see the initiative and the way you guide your siblings and friends and people following you is going to actually better their life, and it's going to help them have a good experience of whatever they are doing. So for me, doing that is, first of all, I would say, first of all, it helped me be excited about myself, and be happy that I'm contributing to people's success. For the first, that's the first thing. And whenever I find myself in among a group of people, or organization, I feel like, how best can I contribute what I have that can better the experience that we are having, or that people have experienced in the past. So I think that personally, it gives me that fulfillment. Then secondly, I think it gives you also the opportunity to get to know a lot of people, get to meet a lot of people, get to understand life in more different way that you might be looking at it. Through that leadership position, I met you, Precious, and I met a lot of wonderful people that today I call friends. I call on them when I need things, or they also need things. We kind of like exchange ideas, and then kind of like have those kind of relationship. And in addition to that, as you work, call it, maybe it also help your CV, your resume. And I tell every mentee that I have that, yeah, we are looking, when every job or position that you get, we are not looking for only people who will come and be perfect in doing what they are supposed to do, but we're looking for something that put you ahead of the others. If you talk about a certificate, everyone has the certificate. If you talk about all the people you are applying is because they all have the qualification that you have as far as academia is concerned. So what puts you ahead of the others? My belief is one of the things that can put you ahead of the others is the leadership position that you've held, and how you help people, and the life experiences that you have. And I think those extracurricular activities give you that life experience. You experience things that people who haven't held those positions have never experienced before. And it's something that puts you ahead of them, and give you that fulfillment as well.
Great. Thank you very much, JJ. Viewers, I'm reminding you again that you are watching the Discovery Show, TDS TV, here on Facebook and on YouTube. My name is Precious Adadidio, ably supported by Mr. James Kobina Opong, and I'm interviewing Jerry John Nutor, who is an assistant professor at the University of California in the United States of America. I've known Jerry a little bit over 10 years, and as we just said, we met through student leadership platform. So basically, he's encouraging everyone to also engage in extracurricular activities, because this is what the world is looking for apart from our certificate. All right, Jerry, thank you, JJ, for, such a great input. Just let's move a bit into academia. I know you have quite varied research interests. I know you are into global health and also HIV/AIDS. That is the key thing I want us to talk about today. You are into women health, maternal and child health, social determinants of health, preterm birth, nutrition, and all that. But let's focus on HIV/AIDS. I mean, the World Health Organization has said that since, this disease came into being, over 33 million people have died out of HIV. We wouldn't want to assume that we already know much about the disease. As an expert in this field, please take an opportunity to educate us. What is HIV? What are the causes, transmission? How do we prevent this? What is working for the world that has resulted in this reduction of deaths and all that? So take the opportunity about 5 to 10 minutes to educate us uninterruptedly on this disease.
Okay. Thank you. I will try as much as possible to be brief and concise with this, because this is a very broad, talking from transmission to prevention and a whole lot of things, but I'm going to try as much as possible to give a little brief or concise response to that. I think HIV started so long ago, and at least in the 80s, that it was actually realized that there is a virus, and that is called, they couldn't find a better way to describe it. So it's kind of like human immunodeficiency virus, and we don't have a better name, but that is the only name that has been given to it. And it has been in existence, as you said, has killed over 33 million people so far. And majority of these, the people who died from this disease actually come from sub-Saharan Africa. Especially in the southern and the eastern part of Africa. And so let me just quickly talk about the transmission. We know HIV can be transmitted through unprotected sexual intercourse, can be transmitted through when your blood come into contact with another infected blood. Can also, in the case of blood transfusion, which has, because of science and technology, that has reduced a lot in the recent years, so not a big problem. And also any kind of sexual contact with an infected person which you are not protected, and the use sharing of sharp instruments like razors, razor blades, and the others can also lead to the transmission of HIV. I know there has been so many myth or misconception about transmission that led to stigma in the past, where people thought that shaking hand and others, thank God we don't see those things again. People, if they know that you're HIV and somebody sits on a seat, they will not kind of sit on that again. We know that is not happening. That is not true. It is only when your blood, the infected person's body fluid get in touch with your blood, or with an open wound that you have. So we know that is not happening. So thank God. And interestingly, there are so many these things. Actually, the reason why I'm talking about this is some of these things lead to the stigma and discrimination, that when we know of somebody with HIV, then we kind of like running away from them. No, it doesn't happen that way. And when we talk about the prevention, we actually talking about actually people practicing safe sex or safer sex by using condoms, if possible, abstain if possible. So we use the ABC, that is abstains, and then the condomize, or that is to use the condom. If you can, or if not can, whenever you come in contact with somebody that has several, you don't know their sexual history or past sexual history and everything, then you must make sure that you use condom. And also you kind of make sure that you don't share blade and those kind of sharp instrument and the others, and especially also drug users that inject blood, also inject drug into their vein, and they share those kind of needles and things. They are also very prone to getting infected. So that is not good practice, and we encourage people to stop that. Then we talk about the mother-to-child transmission, which actually is my research. I try to reduce that. It is said that when people are infected. If a woman, now I think in most developing countries, including Ghana and in Sub-Saharan Africa, a woman, a pregnant woman is kind of expected to go through the HIV screening. And once a person is tested, a woman who is pregnant is tested positive for HIV, it is encouraged that they are put on treatment immediately. Recently, the WHO came with 90-90-90 target. Now we are 95-95-95, expecting that 95% of the people who are HIV positive will get to know their status, and then 95% of those who know their status will have their viral load suppressed, and then will be initiated on treatment. And those who are 95% of those who are initiated on treatment will have their viral load suppressed. So when a pregnant woman is tested positive, we encourage that they start treatment immediately. And the chances of a woman who is not adhering or taking their HIV medication to transmit the virus to their unborn baby or born baby is about 45 to 55%. But with adherence and consistent taking the antiretroviral treatment or the drugs, the chances can reduce to 0 to 5%, which is a good news that every pregnant woman should make sure that they know their status. And then once you know your status, you are initiated on the treatment and you adhere to the treatment throughout. And now it is expected that you take that medication for the rest of your life. And it helps your viral load even go down to the point that when you are tested, they might not be able to detect the virus in your blood, because U equals U, and meaning that you're undetected and you cannot even transmit the virus to any other person, including your partner or your sexual partner, which is very good news. And with these, there are a lot of stories on that you can read and you can watch, that people have been living with the virus for so many years now. You know, initially in the 90s, when somebody is tested or diagnosed HIV positive, it is more or less a death warrant. But now HIV, the treatment, that is the ARV or antiretroviral drugs, are very, very helpful in reducing the death and death rate. So we encourage people, and that is all my studies are about, that how best can we be able to help women who are tested positive kind of adhere to their treatment, so that they are not able to transmit the virus to their babies, which is very important. And as they do that for themselves and also for their partners, because they consistently take the virus, and as they take the baby don't get it, they themselves the virus become undetected in their blood, and also they are not able to infect their partners. So these are the things that we are actually focusing on, and very important that it is true. And talking again about the prevention, I encourage everybody to get tested with HIV. Look, formally, when you get to know your HIV status, you'll be crying, you feel bad, you'll be like, but now with the ARC, people are living for over 30 years with the virus, and they look just fine. They look so beautiful, handsome, just like you and I and any other person. So I encourage everybody. I was in Zambia for my study once, and then people were like, we were talking about this testing. So I said, oh, I will get tested, right? And then there I got tested, and the guys that I was working with on the field, they were afraid to get tested. When you get to know whether positive or negative, it's a good thing for you to know. Then you can be able to plan moving forward. If you are negative, make sure you take the measures that to prevent you from getting it. If you are positive, start immediately on treatment and you will be fine. You will live your life and everything will, you have same quality of life, just like any other person. So everybody, I encourage, if you are listening to me and you haven't tried it before, especially when I was working as a nurse in Ghana, I was testing, because we come sometime, I close from work, I'll just go home and be cooking or washing house something. And I feel like, oh, I have some kind of prick on my hand, right? So I'm like, where did I get that from? I didn't remember kind of having any cuts, but I'm just observing that. So because of that, every month I do the self-testing for myself. I do that every month. I had a kid, like, because there's rapid tests, you can just do it yourself. So I was doing that every month, and I put it in my room and I do it every month. So I encourage people, all my friends, that look, you do it and it's good for you, so that you don't get to a point where things become very advanced that will put you in a very critical situation. I think, yeah, I've exhausted my 10 to 15, 5 to 10 minutes. So if
Thank
any
you
other
very much.
specific question, please ask.
Thank you very much, JJ, for that exhaustive, input from you. Viewers, we are reminding you again that you are watching the Discovery Show TDS TV here on Facebook and on YouTube. My name is Precious Adadidiodu, ably supported by Mr. James Kobnaopong, and I'm here speaking to Jerry John Nutor, who is an assistant professor at the University of California in the United States of America. I can see quite a number of people watching. I can see Dr. Yakubu Salifu Salid. Salid, thank you very much for tuning in. I can see Nanayao. Nanayao, thank you very much for watching. I can see my friend Stephen Adombiri. Stephen, thank you very much for watching. I can see Malina Jordan. Malina, thanks for watching. I can see Dr. Josephine Abuajimensa watching. I can see Chris Kobe Amo watching as well. Dr. Shadrach Dari, thank you for watching as well. I can see a few comments that have come in so far. Stephen Adombiri says, good morning, afternoon, evening, everyone. All right, Stephen, good evening, because you are in Ghana. Good evening to you. And then I see Nanayao saying, great work, Precious, keep it up. Yeah, so far, those are the comments that have come in. Please feel free to drop your comment, any questions you have for Jerry. JJ will be happy to answer it. If it's in line with the HIV he's tried to explain, please drop your comment and we will do well to ask him. So JJ, in line with all you've explained, you've done quite a whole lot of research works on HIV and antiretrovirals, and just to be fair, you've touched on quite a number of them, whilst talking about it, but just to pick some few perspectives or a few specifics on what you have said. Let's talk about, you did one particular research which was quite interesting to me. It had to do with people having place of convenience, what we call toilet, basically, and its impact so far on the adherence to medications. Generally, without going so much into it, how can some of these social and basic amenities impact on people's adherence to medications for HIV treatment and all that? And if you want to expand that to include any other thing that touches on these HIV research works, I'm happy about that. Thank you.
Thank you, Precious, and thank you to all the listeners and those watching. Yeah, so it's very interesting how, when you look at HIV infection and the success and then if you call it failures, I don't want to call that. So if you look at the success in HIV and you look at a trend in HIV infection, you will see that developed countries are trying to beat this virus faster than the countries that are still developing, or if you will call it low and middle income countries. These kind of things has opened our mind to the fact, that social infrastructures are kind of linked to the fight against HIV. And most of these communicable diseases, and as you will. So, for instance, if you look at access to water and toilets in the whole Africa suffers a lot, sub-Saharan Africa to be specific. If you look at maybe Northern Africa, maybe doing a little bit better than us. So when you look at sub-Saharan Africa, you will see that access to clean water, access to sanitation, and days of convenience are kind of things that are very, very difficult to access. Urban and rural communities are almost the same. So you see that some of these things are kind of linked to the HIV infection. So I try to look at how can access to water and toilet influence adherence to HIV. And you will understand that some people experience the side effect of gastrointestinal problem, that is diarrhea, vomiting, and other things. When they take this, when they start, so most people, when they start from the beginning of taking these, the drugs. So what happens is that when you start this and you don't have a place of convenience, that is toilet, or you don't have water to take care of yourself, and you are experiencing some of this at the beginning of you starting the antiretroviral treatment, you are more likely going to stop. Because let's say that there are many homes building across Africa, right, that do not have toilets. And if somebody in that home is tested positive for HIV, and this person and taking the HIV treatment or started the HIV treatment, and when he takes this, he goes to toilet. He has to go to toilet maybe 3, 4, or 5 times a day. How would that person manage it? And the public toilet is very far away. So what would the person do? That person is likely going to stop taking the medication, right? And then, or let's say the person have the toilet at home, all right, but the water is not flowing, tap is not flowing. And that person needs to go several times, and maybe even wake up in the middle of the night to go to toilet, whilst you have to go to the public toilet. So what will happen is that this person will not actually continue taking the treatment. And these are things, and also when you talk about infrastructures, again, you look at the distance to the clinic where they have to go and take the medication. It's a problem. The road networks are not good. So if somebody living far away in a village and has to travel to the city to go and take their treatment, meanwhile, the car that plans that road comes once in the morning and goes back in the evening. So if you miss that car during the day and during the morning, that means that you cannot go. So these are issues that are affecting, and not only HIV, but affect our healthcare system. And you see that we struggle and we are behind. So you can see access to electricity. It's also a huge problem when you talk about vaccine, when you talk about drugs that have to be refrigerated and kind of like to preserve their efficacy and all that. So these are things like social infrastructure things that are affecting our healthcare system in Africa. When you look at it in this manner, you see that that is where, to some extent, we are experiencing this high level of diseases and death, of things, preventable death, let me call it, preventable death in our part of the world.
Wow. Thank you very much, JJ, for, expanding on this. It may look very simple, but it may not care to a lot of us that basic things like water, place of convenience, and all that, they actually impact on people's adherence to medications that are meant to help them treat or manage their conditions like HIV/AIDS. And so to a larger extent, we also encourage people in authority and also individuals as much as we can to try as much as possible to bridge the gap when it comes to social inequalities, social determinant of health and all these. They are very, very important, common water and all that. So thank you very much, JJ, for expanding this particular topic. Viewers, I'm reminding you again that you are watching the Discovery Show TDSTV. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, and the likes. And today we are happy to be hosting and interviewing Jerry John Nutor, who is an assistant professor at the University of California in the United States of America. His research interests are broad, but today we are trying to center on HIV/AIDS. And Jerry has taken us through his life a bit, especially his academic journey. And we've spoken about leadership. There's a sense of taking up extracurricular activities whilst you're in school, because now life goes beyond just the certificate. People are looking for attitude, and all these could be actually amassed through some of these extracurricular activities. So we're encouraging people, anytime you are presented with opportunities to engage in extracurricular activities, including leadership roles, please do well to take up that. Thank you very much for staying and sticking with us. We are speaking to Jerry John Nutor, an assistant professor at the University of California in the United States of America. JJ, thank you again for joining us tonight and in the afternoon at your end. Jerry is not only teaching in the US and all that, but he also has a passion of trying to bring on board a lot of people with different interests. At the end of the day, trying to bring clinicians and people who are researchers together so that we can find a common purpose, a common goal, and a common solution to some of the problems we have. So Jerry has what we call African Interdisciplinary Health Conference. And this is an organization or an NGO, so to speak, that brings a lot of researchers, clinicians from all over Africa together. Jerry, do you want to speak to us about that? What is it about? Yes. Just expand a bit on that. Thank you.
Thank you so much. I wanted to also just say that just for University of California, San Francisco, because there are many University of California, there are 10 campuses. So just to clarify that. So yeah.
Thank you.
Thank you. So I know that has been happening in our published papers as well. So
that's true.
So I wanted to, thank you for that. I work on, I help organize a conference, annual conference called Africa Interdisciplinary Health Conference. And thank you, Precious, for that. So how did I start, or how did we start this? I sat down and I saw how disseminating interdisciplinary work in Africa has been a problem where people come to do studies in Africa. And we kind of like the results are published in journals that we have to have subscription to be able to access. And the results are not shared with us, people from Africa, where the studies are conducted. And even when we want to publish some of our papers in even an open access journal, we are required to pay a huge sum of money, which most of us living in Africa cannot afford those kind of costs, or the article processing costs, or any others. So a group of myself and a group of people, we came together and said, well, how best can we be able to promote the idea of disseminating research findings among ourselves and among our networks, and especially interdisciplinary research. And as you will, currently the condition of our patients continue to become more complex. And there is a need for that interdisciplinary approach to look at it from all fields. Nursing, medicine, dentistry, pharmacy, and occupational therapy, physical therapy, all of them. So we came up with this idea to have an annual conference, and we have been having that since 2008. And thank you, Precious, you've actually helped us in the past 2 years in our planning and also organizing that conference. So that's what we've been doing. We held them two in Ghana. Last year was supposed to be in South Africa, but because of the COVID-19 pandemic, it was held online. This year, we were thinking it was going to be in Rwanda, but unfortunately, because of the situation, the COVID-19 is still almost the same in our parts of the world. So we are moving also that completely to online event, and that will be held between 21st and 23rd September 2021, and will be online. We are still accepting late break-in abstract. So people can visit www.afint.org affect.org for more information. And we've been doing that so far. We're trying our best. Another opportunity for that is to help people, connect people, researchers and people working on the field, and also opportunity to mentor people, because this very one that we were going to have in Rwanda was actually liaising with some kind of some people, mentors, to help early career researchers, people who are starting their researchers on manuscript writing and grant writing. So we were trying to plan a writing retreat in addition to the conference. So we wanted to have it a post-conference event. And eventually we are planning to connect with some kind of credible journals so that we can be able to be publishing even proceeding from the conference. So that is something that is in the pipeline. We are speaking with a whole lot of publishing house and journals so that they can be able to accept that. And also opportunity for people, so our people don't have to travel far away to the other part of the country to present their research finding. That can be done on our soil, and the goal is also to be rotating that annually throughout Africa, or different parts in sub-Saharan Africa. So that's what we have been doing in regards to that.
Thank you very much, JJ. I mean, as you were speaking, I tried to stream 2 of the pictures from previous sessions online, and I think people have seen that. I mean, I was surprised in 2019 when I attended one of the programs as a participant and as a guest for one of the panel discussions. People from all over Africa, and I showed some of the pictures. I was surprised to see people who were actually postgraduate students in the United States traveling all the way to Ghana just to attend this program. And I mean, it was very insightful. Last year was virtual, which I participated as well. I served as a moderator for one of the days, and it was amazing. And I encourage anyone who has the opportunity to partake this year. I'll read a few of the comments. Dr. Yakubu Salifu Salid, he's a lecturer at Lancaster University here in the UK. His main interests are palliative care. He is saying that great program will be nice to look at research areas we could collaborate. So Salid, yeah, of course. You can link up with JJ and that would be great. And then Stephen Adombiri says, Dr. Nutor, please do you mind enlightening us a bit on the role of an assistant professor? It appears the role or the term means something different in other jurisdictions. JJ, do you want to go for that and enlighten us?
Okay, so yeah, thank you. Thank you, Tolifa, and thank you, Stephen. Yeah, so assistant professor, let me try and see. It's you can, somebody can call. So let me start by this way. In the US, I think this is only in the US that I think they do that. So in the US, there are 3 levels to become a full professor. You start from assistant professor, you move to associate professor, and then full professor. And so just like maybe in Ghana and in most European countries, we start from lecturer, senior lecturer, then to associate professor, and then full professor. The US actually goes from assistant professor, then you go to associate, and then to a full professor. And it's the role actually is just the same, doing research, teaching, and also kind of being involved in service or other activities that required you to be very, very successful in your field, and also contribute to the community and other research organizations. So basically, it's not different from being a lecturer, senior lecturer, or any other thing from any other country. It's just the same as you will call it. Yeah. I hope that clarifies. If not, I can.
I hope so.
I don't want to go further. Yeah, but I think that is that's the basis.
Basic, yeah. Thank you very much, Stephen Adombiri. I mean, bro, just let us know if that is clear enough. I'm mindful of the time. We have 12 minutes to bring this to an end. I will try that we do 2 minutes for. I know you are not just having Africa Interdisciplinary Health Conference. I mean, recently you also started a new one with other group of people as well called Africa Interdisciplinary Research Institute. Can you use 2 minutes just to expand on that? And then we use the last 10 minutes to talk about postgraduate admissions and scholarship, and then we can bring it to an end. So talk about AFIRI for us.
Thank you so much. So Africa Interdisciplinary Research Institute. So beside the conference, myself and a group of people have also been thinking about how to have an institute to do research, institutes that focus on mentoring people, and also conducting research and be involved, be rigorous kind of, as people will call it, think tank. We are going in a research way to be able to contribute to research development in interdisciplinary research development in Africa. Like I mentioned earlier on, I realized that interdisciplinary research is something that we do not embrace a lot. I'm not saying it doesn't exist. I'm not saying that, but we don't embrace it a lot. Where we have people from maybe languages or engineering working with people in public health and others, and people even from every field coming together to look at research to better life, and then to be able to mentor people and create opportunity for people also to know and learn more about research work and grant writing, disseminating, even presentation skills. And during this conference, AFIC, that's African Interdisciplinary Health Conference, I observed that there are a lot of young people who are passionate about research in Africa, but they lack the basic things, and that will make them very successful. And some of these things are not provided in a classroom. And there should be an opportunity, a mechanism for them to be able to learn this so that they can be able to be successful. So I realized that having this institute will kind of like provide small grants also to these early career investigators, like a research grant. We are working on that. We'll be making a call very soon. We have research fellows, and then as associate research fellows, we will make grants available for them to do research, and also for opportunities for them to be able to connect with one another. We learn grant writing skills. So, and that in a way put us in a very, very good position to collaborate with people who are even coming from outside Ghana to conduct research in Africa. So we can be better prepared in research method, in grant writing, in disseminating both presentation, manuscript writing, and publication, and all that will kind of like help us. Because currently, I'm sad to say this, if you look at it, people from Africans are kind of like not experts of their own situation. People come and they kind of do studies and other things. I'm saying this very cautiously because we know globalization is very good, but people can be experts on things that is happening on our continent, and they kind of like create the path for us to follow, which shouldn't be the case, because we have excellent researchers, we have excellent people on the continent to be able to drive the path and drive the direction of how we are perceived as far as research, as far as healthcare, as far as education, as far as everything is concerned. But currently it is not happening so. So when we start creating these and start developing these kind of skills and idea among the early career researchers in Africa, I think in a few years, we'll be able to take the position where we can be able to lead our own projects and lead our own direction of research and other things.
Fantastic, fantastic. So there are people with different qualifications. Of course, I have a fair idea of both of them. I'm sure anyone on this platform qualifies to attend any of the conferences for AFIC, but for the AFIRI, who qualifies to be part of what session? So if you can just take 30 seconds just to invite people based on, who qualifies, that would be great.
Good, thank you. So for AFIRI, the website is www.Africa Interdisciplinary Research.institute. And what we're doing is that because we want to make sure we provide the best for people that we have in the team, we have currently the scholars and we have the research scholars and associate scholars. And what we are doing is that we want to the number of people, the team we have is okay, because we want to see how best we can provide support to them. We will be making grant call for them to apply and be able to get grants and do research. Then we can be able to also organize grant writing workshop and things for them. But currently, if anyone is interested, please visit our website and send email to us at info@Africa Interdisciplinary Research.institute. And then if you're interested in becoming a scholar or associate scholar, because what we're doing is that people who have PhDs are scholars, and you have to apply, and then our board will kind of like decide if you are qualified to be a scholar or associate scholar, so we can be able to move from there. And because we want to build that team to be so strong that they can be very, very successful in their research and successful in other parts of their life as well. Yeah.
Thank you very much, JJ. Viewers, again, thank you very much for sticking and staying with us. This is the Discovery Show, TDS TV, here on Facebook and on YouTube. A show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, and the likes. And my name is Precious Adadidio, ably supported by James Kovina Opon. Today we are sitting with Jerry John Nutor, an assistant professor at the University of California, San Francisco in the United States of America. And we've had a very wonderful conversation with JJ so far. Just few comments. So Stephen said his question about the assistant professor is clarified. Thank you. I can see Don Paul Dachehime said, great initiative, keep it up. And I also saw Dr. Shadrach Dari. He said, Dr. Dari said, nice initiative with AFRI, keep it up. And of course, I see Nana Asari said, great. Then I see Irene Fosuhima Bossman said, good interview, Prof. Thank you very much so far. So, I mean, JJ, let's do the final laps of that. I mean, you are an assistant professor. Of course, you look out for PhD applicants and all that. You've gone through masters, you've gone through PhD. What do you look out for in a PhD applicant?
Good question. Yes, good PhD applicant in the US. I try to give this disclaimer. I speak basically in the context that I know. So it's a holistic kind of review. In a holistic, looking at everything about you. So it is not just the GPA, it is just not if you have a research publication, but also it is about the whole of you. And then most of those is also your personal statement is very critically analyzed and critically looked at and see what you have achieved, what is driving your passion and what is your passion. And from there, you can, when you read those personal statements carefully, you will know the passion, you know the direction, you know how successful that person is going to be. And I always say that in those reviews, we'll look at you as a person, look at the experiences you have so far. That is what you are bringing into the program. Okay, what do you want to take in the program? What is in the program that you want to take? And then the third one is, where will you put those kind of things gotten from the program? How will you implement those things that you've gotten from the program? So your personal statement, I always look at it. I always tell people who reach out to me that write it with these three things very clearly. What you have gotten so far, your past experiences, how that prepare you for the PhD program. Now, when you're in the PhD program, that's the second one. How will this PhD program make you a better person? And then the third one, as you become the better person of you, how will you impact the world with the better you? So that is a three-way to look at it. And also, we talk about extracurricular activity. They look at that, look at research, PhD, because the research project you have been involved in, the publication, that is great, the GPA, and then also the recommendation letters. you get recommendation letters from people that you think can really speak to things you have done and your success and everything, and not just a paragraph recommendation letter or 2-paragraph recommendation letter. Talk about you extensively, and mention things that you have done and how successful that you are. Those are very, very important to look at.
Okay, great. Thank you very much, JJ. So generally, which scholarships are you aware of in the United States? If there's somebody watching us for masters, for PhD, you have gone through the system itself. So what scholarships are you aware of that you could just share with us? And of course, just to end, after mentioning them, if you can just touch on 1 or 2 things, especially that enhances people's chances of securing scholarships in the United States. Thank you.
Good. Yeah, the issue of scholarship or grants is a delicate one in the US system that I've observed. All the scholarships that I've gotten, I got them through the program, right? So what I did was my master's program, it was merit. I got it in addition to the admission, that I got. There are scholarships that are out there, but I haven't done a good lot of research on them. And there are scholarships from National Science Foundation and all that, but there are a lot of limits on some of those. You have to be a citizen, or you have to be holding a permanent resident as card or things like that. So for the PhD, if you are applying for a PhD, most, not all, of US schools kind of have some kind of support for PhD students who are coming in. So what I always tell people to do is, when you're interested, reach out to that school's office, admission office, or the program, the chair, or whoever is listed on the program as the contact person, and ask them of available scholarship or grants. Because some come with, once you're admitted, they kind of give you a teaching position or research assistant position for you to be able to be successful in that. So you have to find out from them, because it varies from school to school. And being an international person, which I guess most of the people who will be listening to this will, it might be very difficult to get those ones from NIH. Like there are some grant for pre-doctoral students to get, like call it F grants or T grants and all that. But as a foreign student or international student, that might not be possible. So you can benefit from scholarship or grant or stipend program, the support program that comes from your program directly. And I encourage reaching out to them, to the program, to find out about that, because that is the best way to, because I have a PhD student even coming to join from Ghana for me as my advisee last. And there's that in my school, for instance, University of California, San Francisco, School of Nursing. Once you get admitted into the program, there is 3-year support for you for stipend and also tuition and some kind of thing. So that gives you that opportunity. Once you come in, there are some internal thing, only students in the school can be able to have those access. So if you are outside, you haven't yet applied and been accepted into the program, you can't access them. So for instance, my new student who is coming from Ghana to do a PhD, we talk about that, and like, yeah, once you come in, you are going to make the, like, kind of apply for some of these programs, for some of these grants to be able to be successful. So basically that is it. So I am sorry I cannot mention any specific scholarship or grants for people who might be listening, but that is the situation.
Fantastic. Thank you very much. Thank you very much. Then again, I see people watching Dr. Yakubu Salifu Salid. He is a lecturer at the Lancaster University here in the United Kingdom. Dr. Josephine Abuaji-Mensah is watching. I can see my brother Stephen Adombiri, Malina Jordan, Nana Yao. I can also see Irene Bosman, Nana Asare, Dr. Shadrach Dari, and then a host of people that unfortunately I cannot see. Forgive me, it's not intentional. It's only the ones I see here that I'm able to mention. But today, tonight, this afternoon, this evening, wherever you are watching us from, this is the Discovery Show TDS TV here on Facebook and on YouTube. We have been speaking to Dr. Jerry John Nutor. He is an assistant professor at the University of California, San Francisco in the United States of America. Jerry has taken us through his life, a bit of his academic journey. He's spoken to us about extracurricular activities and the need to engage in them. We've spoken about HIV. It is preventable. And even if you get it, there's treatment. And of course, there are a whole lot of things in place to help you to overcome the disease condition. We've also touched on these social determinants of health, like toilet, water. All these even affect people's adherence to treatment. He's also spoken about the issue of mother-to-child transmission. We've touched on admissions, postgraduate studies, PhDs, and all that. So thank you very much, JJ. I know we've gone over our time just by 5 minutes. Within the next 5 minutes, I know I've just touched on everything you've said already, but what are your concluding remarks? What do you have to tell? Is there anything you left out or I didn't ask that you want to say, or you want to highlight anything you've said already? Please take it.
All right. Thank you. I want to say thank you, and thank you everyone for listening. And I want to just say that, especially I want as many as people from from Ghana, so sub-Saharan Africa, to get to be educated in, with a PhD or in a PhD program. And I have that passion a lot, and I encourage people. So you remember, even at a conference, in our conference, we make plan for how to be so apply for scholarship, also apply for a postgraduate program outside your country and in developed countries specifically. So this is something that I want as much as people to have opportunity and then know about. And I always encourage, I said before, but if you search on the internet, spend the time, get the school, the program you want to do, the country you want to do. Countries, scholarship and admission into a PhD or postgraduate program varies from country to country, and even from school to school, and even in the university from department to department. Some of this information varies. So I encourage people to do the search, reach out to the school or the contact person you've seen on the website, ask them about the information, them. If possible, now everybody's having Zoom meeting and all that. Schedule a meeting, ask questions if you think the email might be too much, ask, and then get them information, and then be able to apply. And as you apply, don't just, I always say this as well, but don't just focus on one school. If possible, if you want to apply to multiple schools, and make your application, your personal statement very strong. And if possible, have multiple people read it for you, or look at it, review it for you. It doesn't hurt. I know a lot of people will say, I want to make it secret. I don't want people to know I'm applying. And no. Because that personal statement is very critical. And even your CV, let somebody look, or some people, not just one person, look at it and then be able to provide you the best feedback. So these are things that are very important. And don't limit yourself to only one school, one university, or one country. And I always tell people, as we live in our country, we are still thinking globally. We are living in one country, but we are thinking globally in everything. And don't feel shy to reach out to people who are ahead of you. And yeah, I'm always available to respond to emails and what have you. Any message that you have or questions, I'll be happy to answer. And then check out my school as well. If you're nursing, if you are somebody who has a master's in nursing and looking for a PhD, we're looking for PhD student also. So University of California, San Francisco School of Nursing. Like I said, I'll be having one student from Ghana join me, as I'll be advising them over the next 3-4 years. So please, thank you again, and thank you, Precious, for the opportunity.
Fantastic, fantastic. Thank you very much, JJ, for sitting with us. Viewers, it's always been a pleasure coming your way with the Discovery Show TDS TV here on Facebook and on YouTube. And as we've already elaborated on, this is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, and the likes. Simply, we just want to come your way with accurate information so that you will also be able to at least take something from that. You'll be able to build on this knowledge, or if you already have, you'll be able to add to what you have, and together we can all rise together. So please feel free to share this stream. Even when it ends, you can still share with other people to watch. And we hope that you've taken something, you've learned something from this interview. Thank you so much, Jerry John Nutor, Assistant Professor at the University of California, San Francisco in the United States of America, for sitting with us tonight, this afternoon, this morning. We don't take it lightly. We really appreciate your time. And thank you, viewers, for watching. And thank you, Mr. James Kwabena Opon, who is the executive producer for this program. My name is Precious Adadidiodu. Thank you, everyone, for watching, and hope to see you next week. We come your way with another interview. I know people have already tried to, make great input and give us feedback that they may also want people from different backgrounds apart from health. Watch out for next 2 weeks. We also come in your way with another exciting interview, just like we've had today. Watch out, invite other people to watch. And please don't forget to subscribe to our channel on YouTube, on Facebook, like, share, and comment on our streams. And you'll be appreciative. Thank you so much, JJ. Thank you so much for sitting with us. And God bless you, JJ. Thank you so much. God bless you, viewers, as well. Thank you.
All right.
All right.
God
bless you. Cheers. Bye.